Today we will discuss the topic anti-emetics. So first we will discuss what is vomiting. So what is vomiting? Vomiting is expulsion of gastric contents due to antiperistalsis. Expulsion of gastric contents So what is antiperistalsis? And antiperistalsis is GI movement opposite to peristalsis, that is from stomach towards esophagus. Normally our GIT movements are from esophagus towards stomach towards intestine. But these are opposite direction. Now vomiting is preceded by a feeling of nausea. Nausea is a feeling of discomfort that occurs before vomiting and is usually a premonition to vomiting. It precedes the vomiting. Now, what is retching? So, retching occurs between nausea and vomiting. It occurs in between the two. So, retching are a series of antiperistaltic movements which are GI movements like vomiting, but there is no expulsion of gastric contents. Now we will discuss the pathophysiology. Behind vomiting. So my first question is, where is vomiting center located? So vomiting center is located in lateral medullary reticular formation. That means it is located in medulla in brainstem. Vomiting center is located in lateral medullary reticular formation. So suppose this is the brainstem, this is the medulla, so it is located in lateral medullary reticular formation. It has following receptors: H1, 5-HT3, M1 and neurokinin 1, NK1. Now vomiting center coordinates the act of vomiting with cranial nerve. It coordinates the act of vomiting with cranial nerve 8, cranial nerve 10 and nucleus of tractus solitarius. So with these three it coordinates the act of vomiting. Now it receives afferents from 4 regions which we will discuss. It gives efferents to phrenic nerve, which supplies to diaphragm, and somatic nerves supplying abdominal muscles. Abdominal muscles. So these are the two efferents, phrenic nerve and somatic nerve supplying abdominal muscles. Now the afferents are received from 4 areas. The first area is chemoreceptor trigger zone. So chemoreceptor trigger zone is located at the caudal end of fourth ventricle. Suppose it is fourth ventricle. So it is located in caudal end of fourth ventricle outside the blood-brain barrier. So from chemoreceptor trigger zone, afferent goes to vomiting center. So vomiting center receives afferent from 4 regions. The first one is chemoreceptor trigger zone. Which is also known as area postrema. It is located at the caudal end of fourth ventricle outside the blood-brain barrier. This is important that it is located outside blood-brain barrier. It is accessible to emetogenic stimuli both in blood as well as cerebrospinal fluid. So it detects emetogenic stimuli, for example toxins in blood, and gives afferent to vomiting center for vomiting. Now what are the receptors located in chemoreceptor trigger zone? The first one is D2 receptor, then 5-HT3 receptors, opioid receptors, and NK1 receptor. Now the second area from which afferents go are vestibular system. So vestibular system of semicircular canals. There the movements in endolymph are detected, and via 8th nerve afferents go to vomiting center. The receptors involved are M1 and H1. So the first afferent is from chemoreceptor trigger zone. The second afferent is from vestibular apparatus of inner ear, along with 8th nerve. Vestibular nerve. The receptors are M1 and H1. Now the third set of afferents grow from GIT, gastrointestinal tract, and these afferents are in form of 5-HT3 receptors. So third afferent is from GIT, vagus nerve and spinal afferent nerves. And the receptors are 5-HT3 receptors. Whenever there is GI irritation, there is release of serotonin in mucus, and this acts on 5-HT3 receptor, and afferents go to CTZ area and to vomiting center for vomiting. And the fourth is cerebral cortex. So exact mechanism how cerebral cortex send afferents is not known, but cerebral cortex is involved in certain forms of vomiting, such as those associated with psychiatric disorders, stress, anticipatory vomiting to chemotherapy, vomiting due to anxiety, etc. So what is anticipatory vomiting due to chemotherapy? Even before administration of chemotherapy, just the person knows that he will get chemotherapy, then only the vomiting happens. So that is known as anticipatory vomiting. So that is mediated at the level of cerebral cortex. So these are the 4 afferents. to vomiting center. Now, what are the various anti-emetic drugs? First, discuss emetic drugs. There are two emetic drugs. Emetic drugs means drugs that induce vomiting. So they cause vomiting. So two emetic drugs are apomorphine and ipecacuanha. Apomorphine is given by injectable route, usually a subcutaneous injection. Its side effect is hypotension. Ipecacuanha is usually available as oral route. However, its effect is slightly difficult to standardize. Now, when are emetics? Ipecacuanha is not given that commonly these days. Now, when will emetics be used? Emetics will be used in cases of poisonings. When there is poisoning, then we want to take out the poison which is still unabsorbed from GIT. So for that, emetics can be used. However, the use of emetics has decreased with time due to risk of aspiration pneumonia. Now, what are the contraindication for use of emetics? First is any corrosive poisoning. For example, acid or alkali poisoning. So emetics are not used as there is risk of perforation. Second is kerosene poisoning. There is high risk of aspirational pneumonia. So emetics are not used. Third is any perforation. If there is GI perforation, then emetics are not used. They may aggravate the perforation. Fourth is any unconscious patient. Emetics are not used as there is risk of aspiration. So these are few contraindication. Emetics are also avoided in hypertensive patients. Now let's discuss anti-emetics. So let's first discuss the classic